All right, one of the biggest needle movers for your concussion recovery is going to be finding your exercise or your autonomic tolerance. Especially if you're an athlete, but whether you're an athlete or not, we want to make sure that you have normal exercise tolerance, that you have normal physical capacity, because it's your autonomic tolerance tells us about your capacity to deliver fuel, to move blood, to move oxygen, and to remove that CO2 and that waste. And if you can't do that efficiently, name any symptom you're experiencing and it's going to be worse. It's going to be harder. The better your autonomic system works, the better your exercise tolerance, the better your concussion recovery all around. Because when you go to do visual rehab, when you go to do vestibular rehab, when you go to do whatever you're doing, you're going to have the autonomic system, you're going to have the fuel delivery system to support that. So one of the first things we'll do is we'll actually get you on a bike. We'll hook you up with a heart rate monitor, so the chest strap like this. We'll put that around, it's going to be skin contact. And then what you're going to do is you're going to start pedaling. And so you're going to pedal, I just want to show you briefly here, we're going to pedal at about this, not even this fast, about this speed, 60 RPMs. And so this kind of just cruising down your neighborhood speed. What we're going to do is every few minutes or so, depending on whether you're doing the Buffalo Concussion Bike protocol, it'll be every minute. If you're doing a modified YMCA protocol, it's going to be every 2 to 3 minutes that we're changing the resistance, we're increasing the watts here. So you have this increased load on your heart. And so what we're looking for as the clinicians is we're checking your symptoms before exercise. So what is your baseline symptoms? What's your baseline heart rate? And then we're watching how those symptoms and heart rate change. So if we get to a certain watt, let's say we get to 125 watts here, we've increased the resistance, and you start to have an increase in headache, or you start to have an increase in dizziness, we're going to look at that heart rate in that moment, and we're going to say, okay, right here, at let's say 60% of your heart rate max, you had an increase in headaches. That's not normal. That's one, diagnostic of your concussion, and two, that's the threshold. Like that's the starting point that we're going to build your rehab. So we're going to go, if your threshold is here, we're going to prescribe exercise here so that we're below where your symptoms would peak, but we're high enough to build an autonomic response, high enough to build some exercise tolerance. And then we're going to slowly push that so that that threshold disappears and you reach normal exercise tolerance. When you can do that as an athlete, you're safe to move on to your sport-specific rehab. You're safe to maybe introduce some weight training, some agility training, some non-contact practice. If you are a non-athlete, you're just a regular civilian, you're clear from your concussion so long as you don't have any other visual, vestibular, cervical, emotional findings or symptoms. Once you have normal exercise tolerance, you are free to leave this office. Safe to say you're clear of your concussion. So this is one of the biggest needle movers. This is hugely important. It's shocking how many patients I've seen in the post-concussion world that have had symptoms for months to even years that have never had their exercise tolerance tested. So something I wanted to talk about briefly, if you're an athlete, you 100% should have one of these tests within by the end of the first week after your concussion. And if you're not, if you're in the post-concussion stage, or you're anywhere in the concussion stage, this is something you should be adding to your diagnostic and your rehab plan. If you found this helpful, go ahead and like and follow for more.